Hit the deck. Let's get ready for tow.
Wake up, champ. Wake up.
The night hospital corpsman gets the up patients on their way to the head. Clean urinals are passed around to the bed patients. Whether ashore or afloat, each patient must be supplied with gear for washing up and cleaning his teeth. Face and kidney basins are distributed, and the corpsman assists those patients unable to take care of themselves.
Hiya, Butch.
Hi. Say, when do we eat?
Listen to the guy. You must be feeling better.
I do.
Now, let's get started.
If a patient comes to your ward without a toothbrush or other toilet gear, you can buy one for him at Ship's or the Red Cross. Proper care of the mouth makes your patients feel better, look better, aids digestion, and lessens the possibility of infection. With the help of the up patients, the ward is policed, basins picked up, washed and sterilized, and everything made shipshape before the new watch takes over. They are informed about changes in the ward census and told about any patient whose condition has altered during the night. The night watch, on his way off duty, will leave all urine and other specimens at the laboratory for examination. Meantime, some men are taking temperatures in the ward. Another man is sent to the ward galley to set up breakfast trays. There's more to setting up a tray than just putting the mess gear on it. A napkin makes it more attractive. And if you've ever been sick, you know how much you appreciate a neat, attractive, complete tray. By the time the steam table arrives, the trays are all set up and ready to go. Cold things and staple groceries are on the bottom, which is not heated. They are taken out first and put up on the trays. Hot food, kept hot in the containers up above, is placed on the trays last. While these preparations are underway,
Cow, let's go. Come on, boys, hurry up.
the up patients who are on unrestricted diet are sent to the mess hall. The rest of the patients in the ward are in two classes, those who can feed themselves and those who cannot. Take out the trays carefully to avoid spilling, and check the roster to be sure the patient is getting the prescribed diet. Most of them will be able to help themselves, so get the trays for those men out first.
Your name is? Phillips. Check.
Thanks, Doc. Oh, boy, that looks good.
Can you reach it?
That's fine.
Okay.
The trays for the patients who need personal attention are served last. No one enjoys having to be fed, but it can be a lot more pleasant than you'd think. Don't hurry him. Give him bites of everything on the tray. And here's a real chance to get acquainted. Shoot the breeze. Let him know that you enjoy talking to him and have plenty of time to feed him. While this patient is getting his breakfast, let's have a look at other kinds of trays. Most patients eat the regular chow. The kind and quantity of food here doesn't vary much from the regular mess. A soft diet is composed of easily digested foods, usually given to those with slightly elevated temperatures, or those whose appetites are below normal. Liquid diets may be ordered for patients who are quite ill or who cannot digest solid food. Liquids, of course, are more easily digested than solids. For diabetic patients, the diet must be carefully weighed. If he has received insulin and he doesn't eat all his food, he may go into insulin shock. The medical officer must be informed if the diabetic patient doesn't eat his diet exactly as given to him. The patient who is on an ulcer diet has milk and cream at frequent intervals. His diet is just as important as his medication. It is essential that each patient gets the diet prescribed for him by the medical officer. wrong food may make him quite ill and may even endanger his life. When all the patients have been fed, it's time to collect the trays. The up patients, back from chow, should lend a hand. With as little noise and confusion as possible, the ward is squared away and the dirty dishes are returned to the main galley to be washed and sterilized. Morning care starts the daily routine in any ward or sick bay. With the help of the up patients and your own cheerful attitude, you've created a feeling of normal well-being, which is good medicine for any sailor.